Every year in Canada, we see over 180,000 new cancer diagnoses. At this rate, we estimate that 2 out of every 5 Canadians will be diagnosed with cancer at some point in their life. In spite of these high diagnosis rates, we do find cancer survival rates have improved over the past 20 years. This has resulted in a large population of over 1 million cancer survivors currently living in Canada. Although many people are surviving their cancers, it's still not without side effects. Many cancer survivors will report long-term side effects, such as you'll see increased fatigue, increased body weight, reduced bone density, reduced physical function, among a variety of other negative physical and psychological side effects. As a result of this, you'll see a lot of research has been done to find new ways to help cancer survivors reduce these negative side effects that come along with the disease and its treatments. One topic that's received a lot of interest lately is physical activity. So physical activity has been found to be both safe and beneficial for many cancer survivors, with those who are meeting the recommended guidelines of physical activity reporting lower levels of decreased physical function and lower levels of side effects as a whole from their cancer. But regardless of this, only 20% of cancer survivors are actually meeting these guidelines and doing enough activity to receive these benefits. So this is basically where my research comes in. So we're looking to help cancer survivors become more active. So my project is working specifically with older breast and prostate cancer survivors to help them improve their quality of life through physical activity. So for my project, what we're doing is we're giving out a physical activity intervention, which consists of physical activity information, as well as a goal setting and planning activity, which will allow cancer survivors to develop their own strategy to become more active, as well as deal with any potential barriers they may encounter when they're becoming active. We're encouraging them to do more aerobic activity, so that will be through home-based activity of whatever their preference is, whether it's walking, hiking, jogging, as well as we're providing them with resistance bands to do some strength training, because that's also very important for cancer survivors. So the importance of this research, obviously, is to help cancer survivors become more active, but it's also going to be a very cost-effective means and a very easily implemented means to help cancer survivors do this. So the typical cost of cancer treatment in Canada is around $65,000 per person. So this type of intervention is very important to find new ways and inexpensive ways to deal with cancer. It's also very easily implemented and can be done across a huge population, whether it's across the province or the country. So in summary, through programs such as mine and doing physical activity with cancer survivors, we're able to decrease the cost of cancer treatment and find new ways to improve quality of life and cancer survivorship for Canadians right across the country. Thank you.